Seating on.
Welcome to Duke Spine Institute. It is October 29, 2024. I'm Dr. Duke Majan. Our patient came to us with two problems. Sacroiliac joint arthritis, pain, inflammation would not go away. The only way to get rid of that is to go in and destroy the 5 pain nerves that go to that joint. Those 5 pain nerves travel from the joint and they go up to the brain. And we ended up cutting all 5 of those pain nerves with the procedure we just completed. Now we're going to release the piriformis muscle. And just so you understand what I'm talking about, the piriformis muscle attaches to the sacrum, over to the hip, and it attaches to the greater trochanter's medial superior surface posteriorly, which is in the back. And she has a tear in the piriformis muscle on the left side. She has exquisite pain and tenderness at the top of her buttock, right there. That's because the muscle's torn, and it usually tears in the middle of the belly. And the sciatic nerve runs through there, so you can even get sciatic pain down your leg, which she does intermittently, but it's mostly buttock pain. Okay, we're going to get started with our piriformis muscle release. We're going to bring the fluoro back in. We're going to use the fluoroscopy or x-ray machine to guide the surgery. And I'm going to go in and release the piriformis muscle from the top of the hip. If you have questions, feel free to ask them. Let's get that leg rotated.
We have a question.
Shot. I will be happy to take the question.
This is coming from AKAROB on Twitter.
Excellent. Welcome to our live stream at Duke Spine.
Asking, will the nerves regenerate? If it does, will you then fuse the SI joint?
That's a great question. So with our treatment, the nerves do not regenerate. And that's what makes our treatment unique at Duke Spine. Nobody else in the world does it. We're the first to do it. And we actually have a patent on it in the United States, so nobody else can do it. But it works, and it's a permanent fix. The nerves do not grow back, and we will not do a fusion of the SI joint. There's no reason to. SI joint fusions, they just came out with a study that showed they're no better for patients at getting rid of SI joint pain than basically doing nothing but physical therapy. So we don't recommend SI joint fusions. They just don't work. All right, making our way down to the greater trochanter. That's the first step. We use a 4mm incision. I can feel the bone. I'm right on it. You guys can see the tip. You can see the greater trochanter.
Yes, we can.
And the piriformis muscle, you can kind of make out the outline. There it is. That's the top, and there's the bottom. We're going to release that muscle off of the greater trochanter, and that's going to take away the buttock pain permanently. It's a permanent fix. Now, we're not the first in the world to do a piriformis release. Much smarter people than me figured it out, but we pioneered a minimally invasive way to do it that is safer than the other ways and more effective. It's only available here at Duke Spine. So we have several treatments that are only available at Duke Spine, including the Duke Laser Disc Repair for discogenic pain, which is the most common cause of back pain and neck pain, for the Duke Plasma Rhizotomy to treat facet joint pain, shot, and the Duke Piriformis Release to treat piriformis syndrome, which is what this patient has, okay, right now. That's what we're doing our treatment for. We are the only facility in the world that does permanent fixes for these problems. She was here a year ago, right, Berndes? Yes. And she had her discs repaired. She had such a great result. She came back when she developed piriformis.
On, please.
She's from, is it Bermuda or? No, it's not Bermuda. Oh, really? All right, she's from Bermuda, I guess. We're going to put a staple. The surgery is really pretty much bloodless. And we're going to take these staples out tomorrow before she goes home. There's another island, but it's not Bermuda. Maybe she's from Bermuda. All right, any questions?
At this moment, no current questions.
4mm incisions for the SI joint, piriformis, permanent pain relief. We've had 100% pain relief with the piriformises that we've done. 0 complications. We've done almost 100 now. All right. Thanks for joining us. Henry, you can take the video off.
Copy
We're
that.
going to uncover the patient.
Of course.